importance of sustainable healthcare. Did you know the healthcare system that's supposed to keep us healthy could also be harming the planet? What if the hospitals and clinics treating patients today are leaving the world less safe for future generations? In this video, we'll uncover the hidden environmental and social impacts of healthcare and how sustainability could be the key to saving both human health and our planet. Welcome to today's video, where we explore one of the most urgent and transformative topics in global health today: sustainable healthcare. We are living in a time when healthcare systems around the world face unprecedented challenges. Population growth, aging populations, urbanization, rising costs, climate change, and environmental degradation are placing enormous pressure on health services. Yet while healthcare systems strive to care for the sick and protect communities, they can also be major contributors to environmental harm, carbon emissions, and inefficiencies that threaten long-term health outcomes. Sustainable healthcare is not just a buzzword. It is emerging as a critical framework for ensuring that healthcare systems can continue to meet human health needs today, while safeguarding the planet and future generations. Sustainable healthcare means delivering medical care in ways that minimize negative environmental impacts, are economically viable, and socially responsible. Throughout this video, we will examine what sustainable healthcare means, why it matters, how it connects to planetary health, concrete examples of sustainable practices, the challenges involved, and the roles that individuals, hospitals, governments, and global institutions can play to make healthcare systems healthier, not just for people, but for the planet. By the end of this video, you will understand why sustainable healthcare must be embedded into the core of health systems worldwide and how that transformation can reshape our future. What is sustainable healthcare? Sustainable healthcare is a framework in which medical care is organized in ways that ensure the health needs of current populations are met without compromising environmental, economic, or social resources for future generations. Underpinning this concept is the idea that human health and the health of the environment are deeply interconnected. Our natural systems, the air we breathe, the water we drink, the food we grow, and the ecosystems on which life depends ultimately shape our health outcomes. Traditional healthcare systems have long focused on clinical outcomes and patient care without fully considering the broader environmental and social costs. Sustainable healthcare aims to expand that view by acknowledging that healthcare itself can have a footprint comprised of greenhouse gas emissions, waste production, energy consumption, and materials used that contribute to global environmental degradation. Environmental sustainability in healthcare means reducing this footprint through strategies like energy efficiency, waste reduction, sustainable procurement, and the promotion of green infrastructure. It also means ensuring that the delivery of healthcare is economically feasible in the long term and equitable in its access and outcomes. At its core, sustainable healthcare recognizes that protecting human health also requires protecting the environments that support life, the economies that fund care, and the communities that rely on health services. It is healthcare designed for the long term, where health systems become part of the solution rather than part of the problem. Why sustainable healthcare matters now. To understand why sustainable healthcare matters now more than ever, we need to recognize multiple converging crises facing the world today. Climate change is accelerating. Extreme weather events, rising temperatures, air pollution, and shifting disease patterns are already affecting human health. Between 2030 and 2050, climate change is projected to cause tens of thousands of additional deaths annually from issues such as heat stress, malnutrition, and diarrhea. At the same time, healthcare systems remain significant contributors to environmental degradation. Globally, healthcare activities account for an estimated percentage of total greenhouse gas emissions, with the largest contributors being energy use in buildings, transportation associated with care delivery, production and procurement of medical supplies, and the generation of waste. If the world's healthcare systems were combined, they would rank among the largest emitters of greenhouse gases. The paradox is clear. The institutions meant to protect and promote health are themselves sources of environmental impacts that worsen health risks. Moreover, healthcare costs are rising faster than many economies can sustain. Aging populations require more care, medical technologies are expanding, and the cost of chronic diseases is increasing. Without sustainable models, many healthcare systems risk becoming financially unstable, reducing access to services and widening disparities in care. Sustainable healthcare directly addresses these challenges by promoting practices that reduce environmental harm, improve efficiency, lower costs, and strengthen the resilience of health systems to future shocks like pandemics, natural disasters, and economic disruptions. The environmental dimensions of healthcare. To fully grasp the environmental impact of healthcare, we need to look at the ways in which health systems interact with the environment. Healthcare facilities use enormous quantities of materials, energy, chemicals, and water. They also generate large volumes of waste, much of it hazardous, that must be safely managed. Hospitals alone can consume vast amounts of energy to power medical equipment, heating, cooling, and lighting. The manufacture and transportation of medical supplies, pharmaceuticals, and devices require resources and often involve carbon emissions. Healthcare's contribution to global climate change is often underestimated. In some countries, healthcare systems account for several % of national carbon emissions. The production of plastics, single-use products, and packaging adds to waste problems that pollute land and water. Transportation involved in patient travel, staff commuting, supply delivery, and emergency transport contributes further to emissions. But the impact goes beyond climate change. Improper disposal of medical waste can contaminate ecosystems, expose communities to harmful chemicals, and increase the spread of disease. Pharmaceutical runoff into water systems can affect aquatic life and contribute to antibiotic resistance. These environmental dimensions of healthcare illustrate that sustainable healthcare must account for the entire life cycle of care, from procurement to disposal, while seeking to minimize harmful effects and maximize benefits. Economic and social sustainability in healthcare. Environmental sustainability is just one pillar of sustainable healthcare. Economic and social sustainability are equally vital. Economic sustainability means designing health systems that can maintain financial viability while delivering high-quality care. Rising healthcare costs are a concern for many countries, particularly as new technologies and treatments emerge. Sustainable healthcare encourages practices that reduce wasteful spending, improve operational efficiency, and focus on preventive care, all of which can reduce unnecessary costs. For example, reducing hospital readmissions, improving energy efficiency, and promoting preventive care can ease financial burdens on both institutions and patients. Social sustainability refers to equity, access, and justice in healthcare. A sustainable healthcare system should ensure that care is accessible to all, regardless of socioeconomic status, geographic location, or background. It should promote health literacy, culturally competent care, and community engagement. Equity in healthcare also means addressing social determinants of health, such as poverty, education, housing, and food security. A healthcare system that ignores these factors cannot achieve true sustainability because underlying social conditions profoundly influence health outcomes, linking planetary health and human health. The concept of planetary health has gained prominence because it highlights that human health is inseparable from the well-being of the planet. Planetary health expands the idea of sustainability by recognizing the interconnectedness of natural systems and human health outcomes. Air quality, water quality, climate stability, biodiversity, and ecosystem function all influence disease patterns, nutritional health, and psychological well-being. When ecosystems suffer, human health suffers. Sustainable healthcare aligns with planetary health by promoting practices that reduce environmental harm and strengthen ecosystem resilience. Reducing carbon emissions from healthcare operations can help slow climate change, while improving waste management prevents pollution of land and waterways. Moreover, healthcare systems can play a role in advocacy and education by informing patients and communities about environmental risks and healthier lifestyles that benefit both individuals and the planet. The future of sustainable healthcare. Looking forward, sustainable healthcare is expected to become more central to global health strategies. With growing recognition from international organizations, governments, and civil society, sustainability will influence policy frameworks, funding priorities, and healthcare models. Innovations in medical technology, data analytics, and digital health will open new possibilities for reducing environmental impact and improving efficiency. Integration of artificial intelligence in hospital operations. Predictive analytics for patient care and personalized medicine approaches could reduce waste and optimize resource use. Collaborative efforts between nations, health institutions, environmental organizations, and academic communities will be important for sharing knowledge, establishing standards, and scaling sustainable practices. Ultimately, sustainable healthcare is not just an initiative, but a paradigm shift in how we think about health systems, from isolated, clinical machines to integrated systems embedded within ecological and social contexts. Sustainable healthcare is more than an ideal. It is a vital framework for the health of people and the planet. In a world of finite resources and growing demands, healthcare systems cannot continue business as usual. If we want health systems that are resilient, equitable, economically viable, and environmentally responsible, sustainability must be at the heart of every decision. The shift will not be easy. It requires innovation, investment, collaboration, and a shared commitment across all sectors. But the benefits are profound. Healthier communities, cleaner environments, stronger economies, and future generations that can thrive without sacrificing the health of the world we live in. Thank you for watching. If you found this video informative, consider sharing it with others and joining the conversation on sustainable healthcare. Together, we can envision and build a healthier and more sustainable future for all.